So without further ado, I will hand over to our first speaker, which is Ashleigh from Risedale Care Home, who's going to talk about social care, how it's different maybe to healthcare, and give you some insights into her care home and the opportunities for registered nurses there. So over to you, Ashleigh.
Thank you. Hello, my name's Ashleigh. I'm obviously going to be talking about working in social care. I work for a company called Risedale Nursing Homes, which is based in the Thorne area. I will go into a little bit more about our homes shortly, but firstly, a little bit about myself. I did the registered nurse degree apprenticeship through Risedale. I started as a healthcare assistant, applied for my nursing through the company, and they supported me through my education. I then became a registered nurse a few years ago. I then became a senior nurse, and I'm now a clinical nurse manager. So there is clear sort of progression within Risedale, and I'm sure across all social care companies. So that's a little bit about myself. What is social care? So social care supports individuals with their activities of daily living, so washing, dressing, the basics, plus helping them to stay medically fit and to ensure they are able to live a fulfilled life and maintain as much independence as possible while providing emotional support as well. So we're looking holistically about the individual and supporting them, anything down from the healthcare assistants providing the basic care right through to the nurses taking care of anything medical, but also providing that general care as well. So social care versus healthcare. So I think when we get student nurses externally, so that have come from university, it might be their first placement, they've never stepped foot in a care home before, or a nursing home, their perception of social care and a nursing home is, or healthcare assistants, they might help wash and dress and make them tea and serve the food, and the nurses are just sort of looking after them. Absolutely, completely the opposite. The nurses in social care, especially within Risedale, do everything. So in hospital, for example, on a ward, you might get the phlebotomist come. Whereas we do our own bloods, we do wound care, we do literally everything that's nurse led, we do ourselves. The only thing we do is we get the GP in, for example, and it's us that are making those calls, and it's us that are making those decisions jointly with the GP. So on the screen, you can see some of the differences between health and social care. So healthcare, so if someone is on a ward in the hospital, they are focusing on treating the acute injury or illness. In social care, yes, we do support in treating that acute injury or illness. However, our focus is on the resident's long-term condition and emotional well-being. And from that acute injury or illness, we will carry that through and continue supporting that individual. Healthcare, so you've got your GP visits, any surgeries, hospital appointments, physiotherapy, anything like that. Yes, we are very much involved in all of that. We are the ones that make in those GP discussions. We have weekly ward rounds, for example, with the GP, and then contact in between if needed. We assist them to appointments and surgeries, whether that's us going with them to support or whether it's aftercare. And we also support with therapy in the home. So we have the physiotherapists come in, we have the OTs come in, and we continue that helping them. So if the physiotherapists give them exercises, we are the ones that are supporting that and continuing it. Healthcare is obviously, first thing that springs to mind is NHS, but there are obviously private medical professionals out there. And then social care, nursing homes. So we are one of the bigger ones in the Furness area, but there are others. And you've got the local council nursing and care homes as well. Healthcare is usually free through the NHS unless people decide to pay privately. For social care, there is generally a cost dependent on the need. So there's a few different things. I won't go into too much detail because it can get complicated. However, we have our discharge to assess beds, which are, for example, funded by the NHS, and that is like a 4-week temporary stay, which could lead to a permanent stay, or it might just be while they get caring at home or they're trying it out, right through to our higher level, both nursing care and behavioural support beds. Healthcare, obviously available to everyone as needed. We can pop to the doctors if you can get an appointment. You can go to the hospital, but social care is based on needs and financial assessments. So, for example, we have several homes. We take people behavioural support, dementia, general nursing, complex nursing. However, not all homes do. Some homes are specialised or based on one, so they might just be general nursing or they might just be dementia. So it does depend on your needs and also financial assessments. A little bit about Risedale. If I could just jump to the next slide. Brilliant. So Risedale has been around since 1987. We have 4 sites within the Furness area. 3 of those are in Barrow-in-Furness, and one of them is on what we call the Coast Road up at Aldingham. It's probably about a 10-minute drive from Barrow, and a 10-minute to Ulverston the other way. We provide a supportive place to work with development opportunities for all staff levels. We don't just train nurses, but our healthcare assistants, our domestic assistants, our kitchen staff all get more than the basic training. And that is because we sort of thrive on delivering excellent care. We do have multiple options for specialist care services. So we do take general nursing care and dementia nursing care, but then we also have specialist units for behavioural support or higher end dementia care. And we also have 2 specialist units for complex care as well. So we do take care of people that have tracheostomies. We do take care of people that have complex spinal injuries, and for example, need bowel regimes, and we very much do all of that. We don't have specialists coming in to support us with that. We do it ourselves, and we have the training ourselves, but we also do a lot of train the trainer training so that we can then train our own staff when we get new qualified nurses, for example. In terms of our accommodation for our residents, these are our 4 main sites. Some of them look a lot smaller than they actually are. So the top left is our Aldingham site, which you can see is extremely grand. It's based on gorgeous grounds, overlooks the sea, beautiful. The top right is Abbey Meadow. That is our newest site, and that has a specialist high-end general nursing unit and behavioural support units. Bottom left is our Abbey Road site. This has a dementia nursing care unit, a general nursing care unit, and another specialist complex nursing care. And bottom right is Lonsdale and St George's, which is a split between general nursing care and dementia care. I just wanted to pop our values up on the screen. We absolutely live these values, and everything that we do is based around these. So the care we deliver, the training we provide, absolutely everything. So just in case anyone can't see it, we invest care. Family is extremely important in terms of involving the families and being part of a general family. We are proud, honest, and inclusive. The roles available in social care. So each home has a nursing manager who is a qualified registered nurse, either in the field of general or mental health. There are at least 2 senior registered nurses on each unit, depending on the size, who oversee the day-to-day care and running of the unit. They're in charge of audits and the overall running. On each shift, depending on the level of care needs and number of residents, there are 1 to 2 shift leads, which are a mix of registered nurses, assistant practitioners, and nurse support. I'll come on to that in a short time. On each shift, there are a number of healthcare professionals. The number depends on the number of residents. Activity staff members are employed to engage with residents and provide a variety of group and one-to-one activities. We have our domestic service operatives, receptionists, and then we have our own dedicated training centre where we have our nursing directors based. We have a finance department, bed manager, training manager, and that's where I'm based as well. So the types of nursing in social care, you can see on your screen, I've popped a few up. So you've got your general nursing, including complex care. I won't read through it because you can see on there. You've got your mental health nurses and nursing. You don't necessarily have to be a qualified mental health nurse to work on one of our mental health units, because we are very much about training our own, and you'll quite often find that we have general nurses that have worked on the mental health nursing units for so long, they can be more experienced than a newly qualified mental health nurse. We've got our nurse managers and our clinical nurse managers. They are based in the training centre to deliver the quality training and support the home managers and other staff with care delivery. However, we do get out on the floor as well and still do those clinical tasks. So routes into nursing through Risedale. So our nursing director several years ago really focused on training our own. So Risedale do offer the higher level apprenticeships for those wanting to become registered professionals. They're currently studied through the University of Cumbria and the Open University, depending on what's suitable at the time. The students have so much support from both the university, myself, I am in charge of the students, and also the staff on the floors. Few different routes that staff are currently undertaking. You've got your 4-year degree route for general nursing or mental health nursing. That's the route that I took. You've got your 2-year assistant practitioner, and then we offer the top up, which is 2 years, recently been reduced to 18 months. However, it is still 2 years with the Open University. And you don't have to have done your assistant practitioner or nursing associate with us to be eligible for the top up. We just interview, and if you're suitable, you have the opportunity. So nursing in social care, I have popped up on this next slide, duties within the care homes, but this is like minimal. You're literally running a shift and leading a shift yourself and doing anything and everything that's thrown your way. So you've got your samples, MSUs, venipuncture, CSU, swabs. You are very much making that decision of, do I need this intervention? Obviously liaising with the multidisciplinary team, obtaining clinical observation, neuro-obs, care plans, extremely important. We audit those monthly, following correct protocol, assessing and dressing wounds. You can see on there is a whole host of things that we do. So it isn't just helping people get washed and dressed, and it's busy. It is very busy. Nursing skills and competencies are the same in social care as other care settings. Again, I think that is a misconception that it's boring being a nurse in a nursing home. It absolutely isn't. It is just as busy as the acute hospital settings. And from somebody who has done placements on wards and in the district, I can honestly say there is no difference in terms of how busy you are. Are they all completely different? Absolutely. Did I enjoy others in ways? Yes, but my heart is in social care, and no matter how many placements I did in the community, in the hospital, I always related it back to social care. So on the next slide, as you can see, we do take newly qualified nurses. We do have a preceptorship programme that we put in for newly qualified nurses. We also have students that come to work with us. They might have come on placement, or they might be just looking for work part-time. We will put them in a role as a healthcare professional and work them up to the nurse support level, which is our own in-house training to leadership. That way, that when they get their PIN, they're very much prepared to take on that nursing role when they get the PIN, and then they obviously will have the 12 months preceptorship as well. So we do take newly qualified nurses. We welcome applicants from qualified nurses, whether they're new or they've been in nursing for a long time, and also those that are due to qualify, even if it's sort of 12 months off. Please don't hesitate to get in touch. Thank you very much.
That's great. Thanks ever so much, Ashleigh. It was really good to hear all about. I think you really gave us a feel for the experience, I suppose, working in a particular home and what all of that entails. So it was really good to hear a real example of that.